We're here at the Health Optimization Summit with Dr. Aseem Malhotra. You have been a leader in the MAHA movement as well as, from the COVID vaccine and just addressing statins and cholesterol and that whole, the misinformation around all that with health. And I want to just hear, what are you here to talk about at the
so my talk today really was the three biggest lies of Big Pharma, which I essentially walked people through the background before I homed in on the specific lies for people to understand that the system is working against them when it comes to health. In particular, the way I describe it is medical knowledge is under commercial control, but most doctors don't know that. So we start from there, everything else then starts to make sense. And then what does the independent analysis, totality of evidence on particular issues tell us about benefits and harms of statins versus whether cholesterol is a risk factor for heart disease, which in my view, the evidence suggests it is not. High cholesterol is not a risk factor for heart disease.
Right.
But that has been a huge cash cow for the drug industry and is still a big focus in driving the fear of people to then take cholesterol-lowering pills to prevent heart attacks when it's completely detrimental and wasteful. So really that's the theme. Right. I think at the root cause of it all, though, ultimately, Zane, and this is something I'm going to talk about in the panel with Callie Means and Max Lugaver and Maha, is that we're not really going to make massive inroads into changing people's health on a population level until we address the root cause, which is the economic system. The economic system allows big corporations to basically lie for profit, control the media, control health information, to exploit workers in the sense that many people, listen, we're quite privileged in many ways that we have enough finances to lead a healthy life. We may not have the right information, but we have enough finances to at least have the basics, like have an income to, put food on our table, to have good quality housing. But, there are 1 million children of healthcare workers in the United States who are living in poverty, of healthcare workers. 25% of men and 35% of women who are healthcare workers in the United States, largest industry, 18.6 million employees, do not even earn the bare minimum to lead a healthy life. They earn less than $15 an hour. It's like, until you sort these problems out, the basic building blocks for a healthy society, there will be no MAHA. And that's the elephant in the room that people are not talking about.
Wow. So you think in economic, to raise the bar for the entire population, we need to give them the means to access it.
100%. And the basic needs that is a human right, that making sure every child has access to education, to quality housing and be able to afford healthy food. It's simple stuff. But this economic system, the way that the corporate capitalist system has now turned into something which it was never meant to be, basically allows exploitation of people for money, where large companies and multinationals will pay their production workers 300 times less than what the CEO is earning. And it's not like the companies are making money through merit. They're making their money through fraud as well. And then they don't pay their taxes. So the whole system is screwed. We've got enough money, it's just in the wrong place. It's a corporate tyrannical system.
Right.
So people need to understand the root of the problem. Everyone needs to realize that we are living in a corporate tyranny. And until that is overturned, we aren't going to make any real progress.
So quite the shift when we had healthcare management companies coming in, taking over county hospitals, which were generally nonprofit. That's where this began to shift.
Absolutely. Because when you bring profit into healthcare, it has the opposite effect. Greater costs, lower quality, more waste. So what you find in the United States, if you look at the United States, people will be shocked by this. The areas of greatest healthcare expenditure are the places with the worst health outcomes. It's almost inverse. The more expensive the drug or the treatment, the worse the outcomes.
Okay. And so we don't need to be vilifying the doctor who's just caught in a system, basically trying to survive, make a living, pay his college tuition, right? Pay his bills. There's a lot of that vilifying of the doctors, and you're right, a lot of them just don't.
They don't know. They're being misled.
And they're scrambling in a system that doesn't really serve them well either.
Not at all. But also, I think one of the problems is they're so indoctrinated in the system that they become so powerful advocates. So when we come out there and say there are alternatives, you can reverse diabetes with a low-carb diet, they're conditioned, partly because of the corporate psychopathic tyranny influences them to do so unwittingly. They're conditioned to start attacking those people and saying, we're quacks, we're dangerous, we're saying stopping statins is going to kill you.
Right.
That's how ingrained within the system this culture has become.
Yes.
So we have to go right to the roots of it and slowly unravel it, and we can do it. And there's a movement, and there's a ripple effect, and there's thousands of people at this conference who are going to hear the message, and ultimately the truth will out.
Excellent. Thank you for your time. I appreciate that. Again, love what you're doing and the risk you're taking by putting yourself out there. You've been in front of the European Congress, you've been in front of our Congress. You're stepping out where other doctors aren't, and I really appreciate it.
Thank you, Zain. And honestly, I am just a medium for a message and the sum of my influences, but I'm just trying to do the best I can with the resources I have, my experience, my clinical experience as a doctor, trying to also go very deep down within to try and be the best human I can be for my patients. And that means acting from a place of virtue. It's really not rocket science, but yes, it does have its challenges and I appreciate it. But there's a huge army now of people behind this movement.
Yeah.
So I don't feel alone.